A counselor says therapy is the answer to keeping kids out of jail.
WDRB's Monica Harkins found out for the kids already in jail, there's limited access to the help they need.
I think it's a huge crisis.
Locked up and left without guidance on how to turn their life around. It's the reality for dozens of Kentucky's kids caught up in crime.
I think a lot of times these kids are forgotten about once they are incarcerated.
Licensed clinical social worker Shawita Smith grew up in West Louisville and dedicated her life to bettering the lives of young people.
Growing up, there wasn't such a thing as going to therapy. I've never heard anyone in my neighborhood talk about therapy.
For the 2 years before it abruptly closed in 2019, Smith was the mental health care provider for JCYC, Jefferson County Youth Detention Center in downtown Louisville. She says the teens she came across experienced the unbelievable.
We're talking about years of trauma. Some of these kids have had issues with violence. They saw people get murdered. So when you think about that and the impact on a child, you're talking about significant treatment that they need.
When the juvenile jail abruptly shut down, the therapy and the progress was shut down.
It was heartbreaking for me. I wasn't ready for that. I wanted longevity working with them.
Therapy is not just one time.
Absolutely not. Therapy is an ongoing process, beginning, middle, and end.
JCYC is set to reopen in downtown Louisville, but there's still years of construction expected. Meanwhile, 5 of the 7 active juvenile jails don't have regular access to a therapist. Fayette, Breathitt, Campbell, McCracken, and Warren juvenile detention centers.
I think it's more important than barbed wire and walls.
A special oversight council in Frankfort put the Department of Juvenile Justice in the hot seat in October as to why it can't fill those positions. Commissioner Randy White says pay, location, and nature of the job.
You know, I don't want to dwell on pay as the only thing, but it would certainly help. We can't pay our way out of vacancies.
There's 3 regional psychologists and a mental health director that can step in.
Does it provide enough coverage?
We would always seek to have more coverage. We would like to have all the facilities filled.
The state is also working with a staffing agency.
I think it's a huge crisis. If they are not working on their mental health and they're abandoned, you're going to see a lot of recidivism.
Abandoned because without JCYC, Louisville kids are currently taken to facilities hours away. Females are sent to Boyd Juvenile Detention Center, and high-risk males are sent to Adair County. Both have mental health professional help. Low-risk males are sent to Campbell Juvenile Detention Center, where they do not have regular help.
I hope that we can all come together and just continue to serve the community and these families and the youth. They really, really, really need us.
A need to better their minds, to find a better life, not behind bars. With photojournalist Dave White, Monica Harkins, WDRB News.